Imagine solving over 20 common health woes with one humble box you already own. I'm Dr. Emily Carter, a clinical researcher with over 25 years in nutritional medicine, and today we'll dive deep into how baking soda, yes, that unassuming kitchen staple, can become your go-to remedy for everything from heartburn to joint pain. Stay with me. At the end I'll reveal a lesser-known trick that only 2% of people ever try. Why baking soda works in your body. Sodium bicarbonate baking soda is naturally alkaline, pH 9. Its power lies in neutralizing excess acid wherever it accumulates, in your stomach, your bloodstream, even on your skin. Pharmaceutical antacids borrow this same chemistry, which means you can often get the identical effect at a fraction of the cost and with fewer additives. Today we'll explore 9 major health applications, each grounded in peer-reviewed studies and government research. Relieving heartburn and digestive discomfort. Acid reflux affects up to 20% of older adults weekly. Rather than reaching for over-the-counter antacids, consider this simple mixture: half a teaspoon of baking soda dissolved in 8 ounces of water. Sip slowly about an hour after your meal. A 2015 review in the Journal of Gastroenterology confirms that sodium bicarbonate reacts with gastric acid to quickly relieve that burning sensation, neutralization reaction, without the extra ingredients found in commercial pills. Personally, I recommend no more than 1/4 teaspoons per day for anyone over 60, and to always check with your physician if you're on a restricted sodium diet. Boosting oral health and comfort. Baking soda's mild abrasiveness and antibacterial action make it an excellent toothpaste additive. It combats Streptococcus mutans, the primary culprit in cavities, and whitens enamel gently. To ease mouth ulcers, canker sores, mix a 1/4 teaspoon of baking soda and an 1/8 teaspoon of salt into 4 ounces of warm water. Swish for 30 seconds, 3 times daily. In a clinical program at Sunnybrook Oral Health Center, 70% of participants reported faster healing of persistent sores when using baking soda rinses compared to standard saline alone. Soothing skin irritations and fungal infections. Whether it's insect bites or athlete's foot, a paste of 2 parts baking soda to 1 part water can neutralize irritants and discourage opportunistic fungi. A 2017 study in mycoses showed that topical sodium bicarbonate inhibited trichophyton species growth by up to 60%. I often suggest my patients apply this paste for 10 minutes before rinsing. Gentle exfoliation follows, leaving skin smoother and less prone to infection. Fighting inflammation and joint pain. Chronic inflammation underlies arthritis pain in millions of seniors. In 2018, researchers at the University of California found that daily ingestion of a half teaspoon of baking soda reduced markers of systemic inflammation by 20% over 6 weeks, improving joint comfort in osteoarthritis patients. While it's not a cure, this simple supplement, when used under medical supervision, can complement standard anti-inflammatory diets and therapies. Example: according to ABC News, Mr. Robert Hayes, a 67-year-old retired teacher in Wisconsin, was struggling with chronic kidney disease and painful flares of gout. Under his nephrologist's guidance, he began taking 1 teaspoon of baking soda daily in water. Within 3 months, Robert's blood tests showed a 30% slower decline in kidney filtration rate, and his gout attacks dropped by half. His story illustrates how a low-cost, well-monitored protocol can translate laboratory findings into everyday relief. Supporting kidney health. Your kidneys work hard to filter acid byproducts. In a landmark trial published by the American Society of Nephrology, patients with stage 3 chronic kidney disease who received sodium bicarbonate supplements experienced a 36% lower risk of progressing to dialysis over 2 years. The bicarbonate buffers acid load, lessening strain on renal function. Always coordinate with your nephrologist before starting any supplement, particularly if you have hypertension or heart issues. Alleviating urinary tract discomfort. Women are up to 4 times more likely to develop UTIs. A 2017 pilot study in urology found that acid-reducing regimens including a daily teaspoon of baking soda helped raise urinary pH and reduced burning symptoms in 65% of participants after 4 weeks. This approach may ease discomfort while antibiotics do their work. Again, medical oversight is key. Enhancing exercise performance and recovery. Athletes have long used bicarbonate loading to buffer lactic acid buildup during high-intensity efforts. Trials in medicine and science in sports and exercise demonstrate moderate gains in repeated sprint activities when subjects ingest 0.3 g/kg of baking soda about 60 minutes pre-exercise. Post-workout, a warm bath mixed with half a cup of baking soda can also ease muscle soreness by neutralizing lactic acid residues. Emerging cancer-related research. Preclinical studies at Johns Hopkins have shown that oral sodium bicarbonate raises tumor pH, making acidic tumor microenvironments less hospitable to cancer cell invasion without altering healthy tissue pH. While still experimental, these findings hint that baking soda could one day serve as an adjunct in oncology protocols. This is far from a standalone cure, but it underscores the surprising potential locked in everyday compounds. Safety guidelines and dosage recommendations. Despite its natural origin, baking soda is extremely high in sodium. 1 teaspoon contains about 1,200 milligrams of sodium, half of the recommended daily limit for many seniors. Follow these precautions. Maximum daily intake, 3 1/2 teaspoons total, limit to 1 1/2 teaspoons if over 60. Duration, no more than 2 weeks without professional oversight. Administration, fully dissolved in water, sip slowly on a partially empty stomach. Contraindications, avoid if you have uncontrolled hypertension, congestive heart failure, or advanced kidney disease without physician approval. Drug interactions, space 2 hours away from other medications to prevent absorption interference. Special populations, pregnant, breastfeeding women and children under 6 should refrain unless directed by a healthcare provider. Baking soda exemplifies how simple, natural compounds can address complex health challenges. We've explored 9 transformative applications from soothing heartburn to supporting kidney function, each backed by reputable studies and real-world successes. Key takeaways. Acid balance is fundamental. Proper pH equals relief for digestion, joints, and exercise recovery. Cost-effective self-care. A few teaspoons per day can replace or complement pricier pharmaceuticals. Professional guidance is essential. Always discuss with your doctor, especially if you have chronic conditions. Pick one of the 9 remedies and try it responsibly for 1 week. Track how you feel, and share your experience below. Don't forget to like, subscribe, and ring the bell so we can explore more evidence-based hacks together. Stay curious, stay healthy, and I'll see you in the next video. Disclaimer. This video is for educational purposes only. Always consult your healthcare provider before making changes to your supplement or health routine.